Good afternoon, everyone. On behalf of Peoria County Board Chairman Andrew Rand, Tazewell County Board Chairman Dave Zimmerman, and Woodford County Board Chairman John Krug, we'd like to thank everyone for attending today's briefing. The briefing today was moved up due to the President's press conference at 4. And in order to save time for some Q&A afterwards, I'll keep my comments brief today. Please continue to practice shelter-in-place directives and adhere to the well-publicized social distancing measures. If we all continue to do our part and urge our families and friends to do the same, we'll save lives and achieve our goals to flatten the COVID-19 curve in Central Illinois. There's so many people in the community that continue to perform their daily jobs and allow the rest of us to shelter in place. We thank all of them for their sacrifices so our community can weather this storm as quickly as possible. When we mention those still working, we don't mean to intentionally leave anyone or any group out. We know there are a lot of you, and you're all appreciated. I was asked to specifically mention all of our U.S. postal workers and other delivery workers today. Thank you all very much. There are several quality websites out there offering up-to-date and accurate information. I urge you all to get your information from a reputable source. There are so many untrustworthy sources out there spreading misinformation and outright lies just to spread panic. You can find links to the many reputable links through the City County Health Department website, the City of Peoria website, or those who are broadcasting this event. Please remember that calm is contagious. Now I'd like to introduce Sarah Sparkman, the Tazewell County Health Department Communications Manager.
Thank you, Mayor Erdis. Good afternoon. Today, the numbers for Tazewell, Peoria, and Woodford County are: we have 9 confirmed cases. We have 80 negative tests have been returned, and 30 tests are pending. A resident of Tazewell County has tested positive for coronavirus, COVID-19. The individual is a male in his 70s and is hospitalized. His exposure is not related to travel, and he is not a confirmed case, close contact of a confirmed case. We did receive those positive test results today. Public health officials were notified according to they were notified immediately according to state and local public health protocols, and the individual, like I said, is hospitalized at this time. However, the number of COVID confirmed cases is not the whole story in our communities. Staying at home when possible is very important to reduce the spread of COVID-19. Illinois has taken additional measures to curb substantial transmission of COVID-19. The governor's orders has changed our day-to-day lives, but this is in an effort to flatten the curve and to reduce the uptick of cases of this virus. I encourage everyone to do their part and make a difference for Illinois. And now I would like to introduce Peoria City County Health Department Medical Director and Chief Medical Officer for Heartland Health Services, Dr. Greg Stoner.
Thank you, Sarah. I have I think a pretty important announcement to make today. There's been a big concern as far as the city, as far as how to deal with homeless people and people that are sheltered right now. And I'd like to let you know that Heartland is developing a mobile clinic. This will be serving initially 4 organizations: the Salvation Army, Peoria Rescue Ministries, both their downtown facility and the Esther House facility on Allen Road, the Dream Center, and Southside Mission. So we'll be providing some screening and addressing some medical needs, particularly those that would put patients at increased risk for not surviving a COVID-19 illness. So we'll be doing that and then linking them up to a primary care physician or provider to handle their continuity of care. So we think this is an important step for our community and think that it will really help this population. and hope to expand that even further in the future. This has been a great collaborative effort between multiple organizations in the community. It's spearheaded, I think, by Andrew Rand, our county board chair, who has really been a driving force for this. And Unity Point Methodist is helping considerably with providing, particularly through their Methodist College of Nursing, their mobile van that we'll be using that's called Molly, and we'll be staffing that with a registration person, a nurse, and a physician or a nurse practitioner to provide care there. The Methodist College of Nursing has also identified 15 volunteers that are going to help as far as nursing students or other members that are attending that College of Nursing, and to help coordinate this care also. Also, we're working with OSF. They have their caravan, which provides mobile care, and they visit many of the same facilities and others that we are not initially going to, and they have their faith-based nurses that interact with the patients or the people that live there, and we will work very collaboratively with them. So I thought this was an important announcement. We're going to start this on Friday with a kind of a test run, and then we'll be kind of in full speed starting on Monday. So thank you. Questions for any of us?
I have two questions, actually.
Sure.
And Sarah, this might apply to you as well. So is he our first community spread? Would he be considered our first, the Tazewell?
So the question was, is this case the first community spread? And we are, from what we can tell from our investigation, there has been no travel and no close contact. So for Tazewell, it is the first case, and we are not 100% sure where it has come from. So we're calling that a community spread.
So he's our first of all the,
It looks that way. I think all the others we've been able to trace back to a contact.
okay.
So I believe this is the first community spread
Okay.
person.
And he is in the hospital?
Correct.
Is he critical? Is he very, very sick?
I do not have his condition at this time. I do know that he is in the hospital, though.
Okay,
He is hospitalized.
okay.
Sorry.
Has testing ramped up in the last week since we've gotten more private labs in on this?
The answer is yes. Testing has ramped up some with the
Okay.
private labs.
Okay.
Some of the private labs are having shortages of viral transport media and nasal swabs and things like that.
Okay.
So they're even having some difficulty keeping up with the demand.
Okay.
And from what I understand, there will soon be a rapid testing site sponsored by one of the hospitals in Peoria.
Really?
In the next, I don't know exactly when, but I've been told that that's going to happen soon.
Rapid testing site, so that would be for people who are sick, right?
That-
That's not gonna be for people who,
Really, it should be limited to people who have symptoms, because otherwise they won't be able to keep up with the demand.
okay, but you'll tell us more about that when it's.
When I know more, I will
comes
gladly
along.
tell you more
Okay.
about it.
All right, and then my final question is, with the lack of testing combined with the message to stay home and tough it out, we don't have a good sense of how sick our community is. Is there any mechanism that the health department has to kind of determine how much sickness is there in our community?
That's a great question. So the question is how to determine the level of sickness in our community overall. And we really don't know that, and there isn't a good way to know that. We're asking whenever someone does a test, even with an outside lab, that they inform the health department that the test has been performed and the result, even when it's negative, so they can keep track of who's been tested and who's negative and who's positive from outside labs. But you're right. There are probably more people in the Tri-County area that would test positive than we have tests positive so far.
Is there more?
And there's not a good way to estimate that number right now. So go ahead.
The IDPH website is still only showing that 4 cases are in Peoria, but you guys are reporting 5. What is the difference between that?
Okay, Sarah, I don't know that one.
So the question was that Peoria is showing 4 cases and we have reported 5. Basically what we've heard from IDPH is it does take a little bit of time for them to determine which county places people are from. So that could be the reason that the numbers are a little bit askew. And what they have said to us is to make sure that we're reporting our numbers, which we know are true. So that's why Tazewell is reporting today that we do have a positive case, but the IDPH release did not mention it, but we have that information, so we wanted to make sure to get it out to the community as soon as possible.
Sarah,
Can I expand on that? So all the cases are labeled as the county that the person lives in, and not where they necessarily work or spend most of their time. So it's not uncommon in our area for someone to live in Woodford or Tazewell and work in Peoria, but they would be labeled as their place of residence.
is it more startling when there's no connection to a case of where the person got it from?
We have been trying to make the message that we've been sending the question was, is it startling that we don't know where the case is from? And we have assumed in the area and all the local health departments, we assume it's out there. So that's why we've been telling people to try to stay home. This is just kind of confirming what we've been assuming. So we know it's out there and we want people to do everything they can to stop the spread.
Sir, if you could explain to people, so often, when we announce a case in a county, people comment, sometimes upset, why can't we know what town, this and that. If you could kind of explain to people why there's not specifics.
Right, and that's one of the things that we as a local health department and all local health departments, any healthcare, one of the things that we are charged with is protecting that person's privacy. It's a medical right. It's part of HIPAA. We cannot release what town they're from. Some of our communities in Tazewell County are very small. So if we say a certain age range and a certain gender, it can be a process of elimination and, so-and-so was at the coffee shop. Well, this one wasn't. So I think we have to be very careful with that. And the other thing to remember is this gentleman is somebody's person. So we need to be mindful of the people that love this person are hurting right now, and so we want to make sure that person is protected and their medical rights are protected for sure.
Not sure if this would be for you, sir, or for you, Dr. Stoner. You're saying this, possibly the first kind of confirmed community spread, quote unquote, but as you have mentioned repeatedly, there's definitely more in the community we just don't know because of a lack of testing. So kind of when will we get to a point where we're stopping to ask the questions of, is this travel-based? Did you know someone who's positive? If we know kind of for a fact that there's so many people that probably have it and can't get tested.
So it's a long question, but and a great question. We don't know like an absolute cutoff when we know when a certain % of the population is already positive, or we're seeing it in so many people, when we need to just quit testing it, when it really won't matter to test, and when following these numbers so precisely won't really be necessary, because we will just assume that it's in the community and it's affecting a large percentage of the population. So there isn't a magic cutoff for, when 5% of the population is tested positive, is that a time to stop testing or whatever? But we are again assuming that it's in the community. We know that there will be community spread. That's what happens everywhere else, and we can just anticipate that that's what's going to happen.
You said Heartland is developing a mobile clinic. You said for Dream Center, Salvation Army, and Southside Mission. I missed the other ones. Can you repeat those?
Peoria Rescue Ministries, and they have 2 sites, one downtown and one called Esther House, which is out on Allen Road.
Doctor, at this time, because of the limited amount of tests that we do have, who is being tested right now? What qualifications do they meet?
They've tightened up the qualifications. If you remember, early on it was you had to have traveled to a kind of a hot spot, either China, Italy, or South Korea, kind of. That was kind of the early thing. Or have known contact with someone proven to be positive with COVID-19. It's now limited even further than that to people that are hospitalized with COVID-like illness, and where they've also ruled out other respiratory infectious diseases. So it's really going to hospitalized patients right now.
So going off of that, do you know when people who are considered at risk because of another ailment that might include, for example, we've been talking with family that, their daughter has asthma, for example, and they weren't able to get tested, but the whole family now thinks that they have it.
Uh-huh. And they certainly may have it, okay? And the question for that would be is, does knowing whether you have COVID-19 change your management? So if someone has asthma and they start to have a fever and cough and worsen, they should contact their physician, probably be seen, their medications adjusted, and ruled out other things that may be treatable, whether it's a bacterial infection or a viral infection like an influenza that has a treatment right away. And then at that point, if they couldn't be tested, assume that they have COVID-19, but there's not a medicine for COVID-19. There's not an additional treatment other than the respiratory support that you would give that person, the inhalation treatments and things like that, and ultimately, if they get very ill, being put on a ventilator. So that's kind of the message that we need to know. Everybody, particularly people that have COPD, asthma, heart disease, all these things that we've talked about at other conferences like this, are at risk, and everybody wants to know. On the other hand, knowing if we test you today, it doesn't mean you're not going to get this tomorrow. And so it gives you some information at the moment, but not for what's going to happen in the future. So,
So you
great question.
Sorry.
Go ahead.
You mentioned eligibility for testing, and I just want to know, do those rules apply to everybody? Is there ever a case where a higher up, and by higher ups I mean government officials, politicians, county leaders, can they just get a test because they want to know?
No, not through the state labs. It has to meet those same criteria, regardless of who you are. And so people could go to their private physician, they could possibly order it through a private lab. That's possible. Anybody can do that. But to be through the public health system and have it tested through the lab, you need to meet those criteria.
Is that an Illinois thing? Because we're seeing.
It's absolutely an Illinois thing,
It's
yes.
an Illinois thing, because we're seeing people all over the country getting tested without severe symptoms.
Right. It
So
is.
it's an Illinois thing.
It is.
Okay.
So kind of going back to what we were talking about, that if you are having symptoms, you should kind of just go under the assumption that you have it. So do you have any tips for families, for example, just if they, because everyone's being told to isolate. So for example, if one family member is starting to show symptoms, should they quarantine in one room? Just kind of what are your tips for families?
That's what people should do. If a member of a family has it, they should isolate themselves from the rest of the family, yes. You can assume that the rest of the family has been in contact with them because it's thought that you are probably excreting some virus for 2 days or so before you're symptomatic. And so they've lived close together and everything like that, so they've probably already been exposed and should think of that. But still, if you quarantine that person or isolate them in a different part of the house or whatever, send them down to the basement or whatever you do, that's probably a good idea at the present time. So, good?
If we were to come up with a test that's cheap
Uh-huh.
and easy, and you could do it at home or whatever, wouldn't that be the ultimate way to manage this?
It would be,
Like daily testing, weekly testing? I mean, in an ideal world,
sure.
I mean, in Korea, they're doing more testing,
Uh-huh.
and they've got it under control somewhat.
Yes, that would be a wonderful approach. If you could do a daily test at home and prove you didn't have it, that would be good. It wouldn't give you a license to go out and be in public, though. That's one of the things, is that it wouldn't change the recommendations right now about social distancing and closing schools and closing all these things. So it wouldn't change any of those recommendations right now, because if you freed somebody up, oh, I'm negative today, and you go out and do things, and a bunch of people do that, it's going to spread more in the community. So, good. Other questions? That's it. Thank you.
Thank you, Dr. Stone.
Thanks.